members of the bus hijacking suspect confirmed to Atlanta News First he has a documented history of mental health issues. According to the Atlanta-based CDC, the need for mental health resources here in Georgia is growing faster than ever before. Atlanta News First reporter Abby Casora shares how a historic amount of state funds will be used to reach people in all corners of the state.
It was really an epiphany when I was laying in my room, and I think I went 1 week without ever leaving my bedroom, and I thought to myself, this isn't healthy. What's wrong with me?
Mary Heath is one of the millions of Georgians suffering from depression.
When you are suffering from any kind of mental illness, that is the most difficult thing.
Heath writes in her book, help is hard to find, especially when you need it fast. Data from the CDC found Georgia had one of the largest increases in the percentage of adults experiencing mental health issues. More than 4 million Georgians live in communities that do not have enough mental health care professionals. Mental Health America found Georgia ranks 48th in the nation for mental health care, resources, and insurance. Kevin Tanner, the commissioner for the Department of Behavioral Health and Developmental Disabilities, says, unfortunately, there's no silver bullet. The nearly $700 million for mental health care in this year's budget is critical.
We're making dramatic progress.
This year's budget includes a $16 million increase for behavioral crisis centers. There are 5 crisis centers scattered across the state, but Tanner says a new study reveals they'll need 8 more in the next 10 years, and they'll need workers too.
We're in a workforce state of an emergency, and I really believe that.
The state allocated $1.5 million to build the David Ralston Center at the University of Georgia. The center will be named after the former House Speaker who passed critical mental health legislation. Tanner says this will be the hub for research and training.
To see the miracles that are occurring every day when people are in a place of crisis and they walk out in a place of recovery, there's really nowhere else that you can work, that you can have an impact on someone's, not only their individual lives, but their entire family's lives.
In Atlanta, I'm Abby Casoris.